Coming to the next question, the filtration barrier in the nephron, it is formed by all of the following parts except the answer would be mesangial cells. So remember that the filtration barrier in nephron, it is a specialized structure within the glomerulus that is responsible for filtering blood to form urine. So it consists of primary components. The first are the podocytes. So these are the podocytes. So these are specialized epithelial cells that wrap around the capillaries of the glomerulus. So these have a foot-like extensions. So these have foot-like extensions. These are known as pedicles. So these pedicles would create filtration slits that are important for the selective permeability of the filtration barrier. The second option is filtration barrier. It is formed of podocytes. Capillary endothelial cells. These cells line the glomerular capillaries that allow passage of water and small solutes. The third is the glomerular basement membrane. It is a thick gel-like extracellular matrix that lies between the capillary endothelial cells and the podocytes. So it acts as a physical barrier to passage of large molecules. So your answer would be mesangial cells. So these are the mesangial cells. So these are not part of the filtration barrier. They are located outside the filtration barrier. So your answer would be mesangial cells. Now, which of these is most commonly used in dental anesthesia? Well, the answer is D, 2% lignocaine with 1:1000 adrenaline. We know lignocaine, it is widely used in local anesthesia in dentistry as it is safe and has a rapid onset. The adrenaline, we often combine the lignocaine with the adrenaline to prolong the anesthetic effect, and apart from that, to control bleeding that is caused by the vasoconstriction. The most common we use is 2% lignocaine with this 1:1 lakh adrenaline. So the answer would be D. Bilateral cleft lip, it is due to the defective embryonic fusion of which of following structure? The answer is D, median nasal process with the maxillary prominence. So the median nasal process and the maxillary process, bilateral leads to incomplete fusion, leads to bilateral cleft lip. An 8-year-old child comes with a bilateral TMJ ankylosis. He gave history of excess snoring, continuous waking in night with daytime somnolence. What would be the treatment? So the patient might be suffering from obstructive sleep apnea. So due to the restricted growth and the function of the mandible. Option A, gap arthroplasty. It involves the surgical creation of gap at the site of ankylosis to allow for some movement. So that would not sufficiently improve the airway in the growing child and not address the underlying mandibular deficiency. So it's incorrect. Costochondral grafting, it involves a rib graft to reconstruct the TMJ. It is important for the TMJ reconstruction, but it may not be the best solution for improving the airway function. in context of severe obstructive sleep apnea? The answer is C, the mandibular distraction osteogenesis. Here we gradually lengthen the mandible by cutting the bone and slowly moving the two halves apart using a mechanical device. So this method will not treat the ankylosis but also improve the airway by advancing the mandible, so increasing the pharyngeal airway space. So that is why the answer is C. The best treatment for type 3 apical transposition is, well, the type 3, the answer is MTA plug. So there are three types of apical transposition: type 1, type 2 and type 3. In type 1 there is minor movement of the physiological foramen, and in 2 there is moderate movement of the physiological foramen that results in heterogenic relocation and potential communication with the periapical space. And in type 3 apical transposition there is severe movement of the physiological foramen. So these cases require obturation to best possible extent followed by the corrective surgery. So the MTA plug, remember the MTA plug, it is used to create a apical barrier in this situation and prevent a seal that promotes healing and prevent the bacterial leakage. So for type 3 apical transposition, the treatment involves using a MTA plug to effectively create a apical barrier due to the significant relocation of the foramen. The flow rate of a 20 gauge cannula is, the answer is 60 ml per minute. So what are the factors that would influence the cannula flow rate? The first is the gauge size. So the gauge size represents the diameter. Suppose you have a 120 gauge and 18 gauge. So remember, 20 gauge would have a smaller diameter compared to lower gauge number, that is a number 18. So this diameter would affect the flow rate. Larger the diameter, higher the flow rate. Apart from that, other factors that affect is the pressure. Increase in pressure would increase the flow rate. Third is the viscosity. Less viscous fluid like the saline, they flow faster than more viscous fluid like the blood. So what are the flow rates of various gauges? Remember, 18 gauge would have a flow rate of 90 to 110 ml per minute. 20 gauge is 60 ml per minute. That would be your answer. And 22 gauge would have a flow rate of 35 ml per minute. So the correct answer is 60 ml per minute. The ketone body in the plasma increases in condition of starvation and in case of uncontrolled diabetes. So during starvation, what you will see is the body depletes its glycogen stores and starts to break down fatty acids. So that would lead to production of ketone bodies, that is acetoacetate and beta hydroxy butyrate in the liver that are relieved in the bloodstream, and they are used as alternative source by the various tissue including the brain. Other option is uncontrolled diabetes. In uncontrolled diabetes, there is insufficient insulin to facilitate the glucose uptake into the cells. So that lead to increased fatty acid breakdown, and there would be increased ketone bodies by the liver. So the lack of insulin also prevent the inhibition of ketogenesis that result in high concentration of ketone bodies in the plasma that can lead to diabetic ketoacidosis. Option B is well-fed state. So in well-fed state, the body has sufficient glucose and insulin level to meet its energy needs, and that is why no ketone bodies production would be seen. In protein deficiency, that does not typically lead to increase in ketone bodies. So your answer is option A. Coming to the next question, which of following is not rational? The answer is tetracycline with tazobactam. Option A is sulfixime plus sulbactam. We know sulfixime, it is a third generation cephalosporin. And sulbactam, remember sulbactam is a beta lactamase. So this combination can be rational because sulbactam, they can protect the sulfixime from being broken down by beta lactamase enzyme, so thereby extending its spectrum of activity. Tetracycline, we know it's a broad spectrum antibiotic that inhibit protein synthesis by binding to 30S ribosomal subunit. Tazobactam, we know it's a beta lactamase inhibitor that protects beta lactam antibiotic from enzymatic degradation. As tetracycline is not a beta lactam antibiotic and it is not susceptible to beta lactamase, combining it with tazobactam is not rational. So your answer is B. Coming to the next question, the oral malignancies can be seen in, the answer is xeroderma pigmentosum. Well, xeroderma pigmentosum, it is a rare autosomal recessive condition. So that is characterized by extreme sensitivity to the UV lights, resulting in sunburn, frecking, and increased risk of developing skin cancers, including the squamous cell carcinoma, basal cell carcinoma. So they have increased risk of developing ocular lesions, and they are prone to develop malignancies. So that is why your answer is T, xeroderma pigmentosum. A patient with pulp exposure has calcium hydroxide applied directly to exposed pulp to preserve its vitality. So this procedure is known as, this is direct pulp capping. So here the calcium hydroxide is applied directly on the exposed pulp to promote healing and preserve the vitality. So the purpose of direct pulp capping is to create seal over the exposed pulp to protect it from further infection and the inflammation. To manage perioperative bleeding during surgery, crystalloids, they are given in which ratio? Traditionally, remember 1:3 ratio of crystalloid to blood loss was recommended. But according to the current hypothesis, 1:1 is sufficient for maintaining the hemodynamic stability. That means the patient blood pressure and perfusion are kept within the normal range. So remember, lung function is important parameter. Excessive fluid can lead to pulmonary edema that would impair the gas exchange and may cause acute respiratory distress syndrome. So by reducing the volume of crystalloid to 1:1 ratio, it is expected to minimize the risk of fluid overload, and prevent the edema in the lungs. The star-shaped inclusion bodies evidenced in sarcoidosis, they are remember they are the asteroids body. So the answer is asteroid bodies, they are seen in sarcoidosis. Warthin-Finkley bodies, they are seen in measles. Donovan bodies, they are seen with Klebsiella. So answer is C. So these are the asteroid bodies. The muscle of mastication that causes depression of mandible, the answer is lateral pterygoid muscle. So remember this lateral pterygoid muscle, that is primary muscle that is responsible for depressing the jaw. It pulls the condyle forward and aids in opening of the mandible. So it works by pulling the mandible forward downward, that leads to depression of the mandible. So answer is lateral pterygoid. Next question, the bicarbonates release from pancreas, it is stimulated by the remember the bicarbonate release is stimulated by secretin. So secretin, it is a hormone that is produced by the S cells of the duodenum in response to acidic chyme. So it stimulates the pancreas to secrete the bicarbonate rich fluid. So this bicarbonate would help to neutralize the chyme as it enters the small intestine. Option C, gastric. Remember gastrin, it is hormone that is produced by G cells of stomach. So it stimulates the secretion of HCl by the parietal cells of stomach, and it aids in gastric motility. Option B is cholecystokinin. Remember it is a hormone secreted by the duodenum. So it stimulates the gallbladder to contract and release the bile, and it stimulates the pancreas to secrete digestive enzymes. The renin, it is enzyme secreted by the kidney that play a role in blood pressure and electrolyte balance. And it does not influence the pancreatic bicarbonate secretion. So your answer would be D. Which of the following features are true regarding the anak? Well, the answer is D. So the answer is bone loss is C, and punched out, this is true, and punched out crater-like lesions, this is true. Nugget is primarily caused by the Fusobacterium, Prevotella and spirochetes, and it is not typically due to the viral infection. So option A is incorrect. NUC can lead to rapid and severe periodontal destruction, including bone loss. And one of the hallmark feature is the presence of punched out crater-like lesions on the interdental papilla. While the gingival recession it can occur in chronic periodontal disease, it is not a primary or defining feature of an NUC. So answer is D. Next question. A 10-year-old child come after road traffic accident with persistent bradycardia and hypovolemia. There is herniation of orbital content. What is diagnosis? The answer is white eye syndrome. So white eye syndrome, it is typically seen in children after orbital blowout fracture. So you will see bradycardia, herniation of the orbital content. They are indicative of this condition. So there is a trapdoor like fracture of the orbital floor leading to severe pain, and that could lead to symptoms like bradycardia. Which of following cells they are deficient in AIDS? The answer is CD4 cells. So AIDS, it is caused by HIV immunodeficiency virus. The primary target is the CD4 T helper cells. So T cells, by binding to the CD4 molecule on a co-receptors, that is CCR5 or CXCR4 on the surface of these cells. So once inside the cell, HIV uses the cell machinery to replicate and produce new viruses. There would be destruction of the CD4 cells. So the replication process that causes the death of the infected CD4 cells. As the CD4 cells decline, the immune system becomes impaired, leading to the development of the AIDS. Pseudohyphae, they are observed in Cryptococcus. So that is, so the most common presence of pseudohyphae is seen with the Cryptococcus. So Cryptococcus, it is a fungal genus that commonly caused by infection in HIV individuals, particularly with the patient with the AIDS. The fungal cells of Cryptococcus, they are encapsulated yeast cells, and on microscope you would see pseudohyphae. A 25-year-old female with a depression developed a buccal lesion and was prescribed linezolid. Which of following could potentially result as a dry interaction? So when linezolid is combined with MAO inhibitors, it can lead to condition that is known as serotonin syndrome, that is characterized by confusion, hallucination, rapid heart rate, high blood pressure, fever. So there would be elevated increased blood pressure. That is the feature. So if patient is taking depression and is prescribed linezolid while taking MAO inhibitors, it can result in drug interaction leading to elevated blood pressure that could exacerbate the symptoms of the serotonin syndrome.